In the next row, it's the begin effective date. Now, this row, we don't actually have much to do here. Whenever we create an order set or create a new version of the order set, it automatically updates for us. So over here, it says the 21st of February, 2016 at 21:32. So that means I created a new version, which is version 3, at that particular time. Now, if I went back to previous versions, let's say version 1, it was created back in 2014, years and years ago, when we didn't know as much. But as we create and update these order sets, we'll continue to have more versions, and each version will have the begin date, which is quite handy. And then end effective date actually hasn't ended yet, so obviously it will say current. So the next row, reference text row. Now, if we had information that we wanted to present to, let's say, a physician or the user within PowerChart, we can actually present or put in some reference text here. Now, reference text can be several different things. In some cases, we actually have tables that we can show the physician that, if you order this or have this, you can click on a particular note and it'll present information to you. Let's exit out of that. Now the evidence link, now kind of similar to the reference text, we can actually embed links to a website here. So let's say BC Cancer Agency had a nice link to a PDF on their website, and we want to use that. We can actually embed that or that link to the order set, so it actually creates a link icon, and the user within PowerChart can actually click on that, and it brings them to that particular web page or PDF, etc., etc. And we can do this for all order sets and actually at the order level as well. But in this case, we actually don't have anything, so nothing to show you right here. And then the duration and the duration unit rows. Now, from an order set perspective, it's not, at least what I've run into, not used. Now, if we're talking at an order level, it is used. And in the previous video, I did go over the TNN and offset timing. Now, when I get to the video on orders, I'll go into this a little bit more depth of offsetting the times for particular orders. But just want you to keep in mind that if I clicked on an order, let's say complete blood count, we actually have the start offset quantity and start offset unit we can change here, which actually it functions the same as the TNN. And I guess a good example right here is just right below is the T+1 and then the semicolon 0600. So what that means specifically in the order set in details language is that this will be ordered tomorrow at 6 o'clock in the morning. That's when we want lab to collect the blood to do the tests. Clicking back here. Now, the next major thing that we have to worry about is facility flexing. Now, facility flexing, it sounds kind of weird at first. It doesn't really explain what it does, but the gist of it is it explains what is available at what site. So here at Energy and Energy-MH, this stands for Nanaimo Regional General and Nanaimo Regional General Mental Health. Now, Nanaimo Regional Hospital itself is broken down to at least these two sections. And what it means is if I was to order a cardiac admission order set, these would be available there. Now, if I just had NRG and I did not have NRG-MH and I was a physician on a mental health unit and I tried to search for this or particular order set, it actually would not show up in PowerChart. So this is very important, and it's very important to set properly, or people searching for it will not be able to find it. And from the Manage Virtual View facility or virtual facilities, we can actually search for different places. So let's say I was looking for Dufferin long-term care. Type in Dufferin and it would be here, and I would be able to easily just click on it and bring it over to the side. But in this case, we do not want that, so we'll remove it. And I will exit out here. Now the subphase row, as I was going back in the previous video about modules, now modules, in Cerner terminology, that's called a subphase. In our organization, we call it modules or mini sets. Basically, they're synonymous with each other, but they mean the same. So how modules or subphases work is that they can be embedded in a parent order set, but we cannot embed an order set or a subphase within an order set or a subphase. So that would be what we call module inception. It would go on forever and ever and ever. We can't do that. It's not possible. So the subphase row is actually dithered out. We actually can't click on it. It doesn't work. And in another video, I'll actually go over modules and mini sets and how they function specifically in terms of order sets and the whole ordering process in general. The next row, allow diagnosis propagation. Now we actually don't use this within our organization, so can't honestly speak much about it. But if I do remember, or shouldn't say remember, but if I do know more about it and it pertains to CPOE ordering, I will update this video and put something in. Now, hide flex components. Now, this is important as well, and it kind of goes back to the facility flexing in certain ways. Now, when we flex an order, kind of like how we flex a facility where this can be found, we can flex orders, or another terminology we use is virtually view orders. So let's say within this order set, let's go through here. Let's say for some reason the complete blood count and differential blood test under laboratory is not available at NRG. It wouldn't happen, but acute care hospital not having complete blood count with differential, but let's say hypothetically it was not available, and it's only available at NRG mental health. So what would actually happen if we had this ticked off and this order wasn't available? Actually, it just wouldn't show up within the order set. So we'd pick up this order within PowerChart, and this would actually just be blank. So this would be the first one that we have ticked off here. It would be not there, and then we would have the note, and then the complete blood count and the INR. Now, if we didn't have this ticked off, basically what it would say is, it would say not available at this facility in PowerChart, and we'd actually have to go through and kind of search for it and see, well, we got to make this available, or etc., etc. The next setting, cycle settings, actually haven't used this, so I can't really say much about it. But if I do find out more about it, I will actually update the link, or update this video and link it to another video. Default view, same thing as above. Haven't really been using it. Prompt for ordering physician, same again. It's not from at least a CPOE perspective. We do not use this. Now, copy forward, again, don't use. Related results, don't use. Now, check alerts on planning, we do use. So if there's any kind of alert when we plan an order set, it will actually pop up a window for us. And this is important to have ticked on. And some of the rest of these right over here, I'm actually going to pass on these because at least from a CPOE perspective, we actually have not used them, at least within our organization. If things do change, I will actually create a new video and update the links in here, or at least create links to the new video so we can talk about it. And I'm done.